lot of my job as a birth doula is just to help people know what questions to ask their medical care providers so they can get the most out of their medical care. And so I thought I would just read to you the list of questions that I give my clients to ask if they're either considering an induction or think they might need an induction for medical reasons. First step is just finding out if like you have risks that mean that like you need an induction for medical reasons, or like if it's going to be an elective induction, which sounds simple, but it's usually not very cut and dry, and a lot of people are very confused as to whether their induction is medically indicated or if it's just purely elective. Just asking, is this a medical induction? Is there a medical reason why you're recommending an induction? What are the current risks to my baby or my health that are spurring the recommendation, and how serious are they? What are the risks of me not getting an induction and continuing my pregnancy? Are there any reasonable alternatives to induction, like medications to help manage like the problem, tests I could consider instead, things like non-stress tests, BPPs to monitor the pregnancy further? Are those options? This is that if you're open to getting a cervical exam, you can ask about the results of that cervical exam and calculate your Bishop score. So a Bishop score is where you analyze different things about the cervix, like its effacement, its positioning, its dilation, and determine how likely your body is to respond to an induction of labor. So you can ask about your cervical dilation, ask about your Bishop score, and then also ask, like, at my current cervical dilation, at the week's gestation that I am, like, what would an induction likely look like for me? Like, do I need cervical ripener? Do I need a Foley balloon? Do I just go straight to Pitocin? Do I just get my water broken? Like, what would your plan be if I was to walk in and get an induction? And then also, like, with the knowledge that there's drastic variations in labor induction time and people respond to it differently, do you have like an average time that you think that this might take or that I should expect this to take? And then next, like, what happens if I don't respond well or my baby doesn't respond well to the medication? Like, what are the next steps? How would the steps change? So like, if I don't respond well to cervical ripener, do we just go straight to Pitocin? Do we try a Foley bulb? Like, knowing what plan B, C, D is, that would be helpful. And then is there a point where I could stop the induction and go home? This is only really for like an elective induction, and obviously like a medically complicated induction, usually you're there because you have to have a baby. But for an elective induction, is there like a point? Usually the point is that you can't go home once your water's broken. But like, is there a point where I can decide like, hey, I'm not responding well to this induction, can I go home? It's important to know the cutoff for that, so that like if you're thinking about maybe wanting to like stop the induction and go home and wait for labor or try again another day, that you don't like cross that line of like, oh no, now I have to stay. What does it look like for me to stay pregnant? So like if I choose not to get an induction, what are the next steps? Like, are there additional testing involved? Like, do I need to get non-stress tests or a biophysical profile done? When would these things happen? What happens if next week I walk into my appointment and I'm still pregnant? Like, what will happen at that appointment? What would the conversations be? So that then if you choose to stay pregnant another week, when you walk into that next appointment, you're prepared for like what the conversations and options are going to be. What are like the true risks of me staying pregnant? Usually it's more beneficial to like have like the statistical chances of different like bad things happening, because sometimes if you just hear like, oh, there's an increased risk of stillbirth after 41 weeks, that's a lot scarier to hear than to hear like the actual percentage point like difference. It just helps you a little bit more logically like take in that information and then like think through your options and what you're wanting. And then lastly, what options do I have during induction, and how does an induction limit my options for pain relief, movement, etc.? Like, when do I need to be hooked up to an IV during an induction? Do I have to have continuous monitoring? Is there a point where I'll be cut off from eating or drinking during this induction? Is there a certain point where I won't be allowed to use the tub during the induction? Like, if I'm on Pitocin or my water's broken, can I use the tub or the shower? Each hospital has different policies on these things, so ask your provider, like, what are the rules about these things? And when I'm utilizing these different interventions for an induction, what are the rules and limitations surrounding those of how they're going to change what my birth is going to look like compared to a spontaneous labor? Let me know in the comments if there's any other scenarios that you want me to tell you, like as a doula, what questions I would ask in those scenarios.